In a disturbing trend, Karnataka is witnessing a rise in the number of cases of early stage cancer. A group of researchers found that there is an average annual increase of 1% in cancer among men and women in the state. The term cancer still carries a lot of negative connotation to it, but the awareness this disease needs is crucial. I spoke to Dr. Shruthi, a consultant in surgical oncology, on the importance of early detection, screening, and prevention of this disease.
So when we talk about the common cancers, it is different for men and it's different for women. So if in men, if you take the most common cancer in our country currently is oral cavity cancers, or you can call even the lip also is included in that. Second would come your lung cancer. These are mainly caused due to tobacco smoking or chewing form of tobacco. That is why it's more commonly seen in males and the most common cancer also. Followed by that, in males you can see colorectal cancer, stomach and esophageal cancer. Whereas when you come to women, the most common cancer in women in our country is breast cancer. And even when you take combined women and men together combined, still breast cancer stands at the topmost, being the first most common cancer and also the most common cause of death in our country. Second most common cancer in women would be cervical cancer, that is the cancer of the mouth of the uterus. And followed by that would be your ovarian cancer in females, and then lip and oral cavity cancers. So these are the most common cancers seen in our country at present. Curable cancers, there are a lot of cancers that are curable but only when detected at an early stage. If you want to talk about the most curable cancers in our country, if you say thyroid cancers, I would say is the one form of cancer that can be cured, because most of the thyroid cancers are papillary carcinoma or follicular carcinoma. These are cancers that can be cured even when detected at an early stage. Whereas in other cancers, only when it's detected at an early stage, it is considered curable, that is at stage 1. That would be in form of like breast cancer can be cured if it's detected at stage 1. Definitely not for everybody, but for most of the people, breast cancer detected at stage 1, it is definitely curable. And there are also screening methods available for various other cancers like cervical cancer, which can detect cancer even before it is developed. That is something called a pre-invasive stage or a pre-malignant stage. That is, there are changes that has happened, but it is not yet developed cancer. It's going to take about 10 years probably for the cancer to develop. So when we detect it at that stage, this can definitely be cured. So in case of cervical cancer or colon cancer, we have the facilities to detect it even in a pre-invasive stage. So if detected at that stage, it can definitely be avoided. Cancer can definitely be avoided. Cervical cancer, definitely. Breast cancer, nowadays many people are getting to know. Cervical cancer also, now the talk has begun, especially after the Poonam Pandey controversy. Now the talk has begun, but previously cervical cancer was the topmost cancer in our country. Slowly, because of the lifestyle changes, breast cancer has gone ahead. Cervical cancer is still something that not many people talk about, because one is uterus and cervix is something that generally is not spoken about. Even among women, it's not about the men, I'm talking even among the women, they generally don't talk to people. They are having some issues, having some bleeding problems. They generally don't discuss it. They think it's a taboo to discuss about it. Yes, definitely. There is a lot of taboo, and also not much awareness. So people do not they do not know that something called cervical cancer is present. So they do not know that bleeding could be because of cancer also. They might be thinking bleeding is probably because of some other issues, of their hormonal issues or something. So do not expect that it to be cancer, so they delay in presenting to us. And also one more problem when you talk about early detection is one more problem, especially I've seen in my female patients, is that now it's become a busy lifestyle for everybody. Everybody is busy in their own life. So most of the women who present to us, older women, they tell me, like when I ask them, why didn't you come earlier when you have noticed the symptoms? They have a feeling that it could be cancer, but they tell that I didn't want to trouble my family. I didn't want to become a burden to them. That is the main reason why patients do not present to us, because they are more of thinking about their family rather than themselves. So that is also one reason that we have seen more common here presenting to us. It's, I feel, more of a taboo because cancer, the treatment has advanced in over time. It's advanced a lot. Most of the treatments are now like it can be afforded by even the very low socioeconomic status also, and even there are government schemes that provide free cancer treatment for the very low socioeconomic status people. And also it is not as costly, even whether you see chemotherapy or immunotherapy, it is not as costly as it was when it began. So it is not only about affordability, it's more of a taboo still now, and less of awareness, because there's also one more reason I feel is many people, like say for breast cancer, many people feel the lump. They feel a lump in the breast, but then it is not painful. So they'll tell it was not painful, so I did not think it would be cancer. They always have this association that cancer is painful because they might have seen someone in their family who has suffered from cancer, who has gone through a lot of pain. One thing they have to understand is when they have seen someone suffering from cancer going through a lot of pain, that probably could have been an advanced stage of cancer. Cancer is usually painful only in advanced stage. And most of the cancers, I'm not telling all, most of the cancers initially when they start, they are painless. Painless to start with, whether it's a breast lump or even for that matter any lump anywhere in the body, most of it is always painless. So initially when it is painless, that time if you detect it, then it can probably be in an early stage. If you wait for pain to occur and then only I will go to the doctor, when there is pain, then only I will go to the doctor, that it will almost become a late stage by then. So that is one more problem. So, and awareness is still lacking somewhere because of that, because always they associate it with pain. So just that I have to be very clear, because pain is not the first symptom of cancer in most of the cancers. Pain does occur sometimes, like in bone tumors. Pain may be the first symptom because there is no other symptom other than that. Most of the cancers are usually painless. They always are painless to begin with. Any lump or any other swelling anywhere in the body are usually painless to begin with. So when you present to us with that stage, then we can have high chances of cure. Definitely not. See, there was a time. It is definitely a myth. There was a time when cancer treatment had not advanced so much. For example, if now in breast cancer itself, initially when breast cancer was detected, this is ages ago, that time surgery was the only treatment. That time it was a radical surgery. Removal of everything surrounding breast and surrounding tissue, surrounding muscle, skin, everything. It was a radical surgery. Slowly it advanced. Then the surgery became less radical. That is, we could preserve the skin, we could preserve the muscle, remove only the breast. Then slowly it has advanced much more. Chemotherapy was introduced. So after the surgery, chemotherapy was added. So that did definitely benefit the patient. Now it is much more advanced that we are giving chemotherapy even before the surgery. So in that way we are able to assess the response of the tumor to the surgery. We can know the biology of the tumor and so many other factors that are taken into consideration there. And now even targeted therapy has come. So all these are helping us in improving treatment in a much better way. So it is definitely not fatal now for most of the cancers. Cancer treatment has come a long way from what they've seen. They might have seen their family members who have suffered from cancer, but that might, again, as I told you, it might have been an advanced stage. When you present in a metastatic stage, there is very little that we can do. Only when you present to us in an early stage, there's a lot of options that are available now that you can consider. So it is definitely way more curable nowadays than what it was like about 20. Even chemotherapy also started little very late only. So 20-30 years ago, if you compare that with now, we have much more advanced treatments, advanced surgeries. So definitely I will say cancer is not at all fatal now. So first important early detection is mainly it's going to help us detect in an early stage so that treatment options are available and cure rate is high. So more than early detection, I would like to first stress on prevention here. So we still have not advanced to a state where cancer is preventable. Not all cancers are preventable till now, but still there are few cancers for which vaccines are available that can help in preventing the development of cancer. That is, one is cervical cancer and other one is liver cancer. For cervical cancer, there is HPV vaccine that is available. HPV vaccine, if it's given for young girls between the age of 19 to 14, it can be effective even up to 99% in preventing cancer. So that is where we have to go early. More than early detection, prevention is important for us. So prevention is the first step. So first, when we prevent, we do not allow the cancer to occur at all. So that is what we are concentrating on more now. Definitely all cancers don't have this option, whether it's breast cancer or oral cavity cancer or for lung cancer. That option is not available. For cervical cancer, it is available. And other cancers which can be prevented through lifestyle changes, yes, by stopping smoking, stopping alcohol, or diet changes. All these can definitely help in preventing a lot of cancers. But next important after this would be your early detection. So now we cannot prevent the cancer. So like a breast cancer, we cannot prevent it. It's going to occur, whatever happens, it's going to occur, you cannot stop it. So the most important part we play here is early detection. So how early detection can be done is by screening tests that are available. Screening test, the first thing you have to understand is it is not a test done when you already have a symptom. Suppose you already have a lump or you already have some bleeding or you have a ulcer somewhere or a mouth ulcer or something like that. That time the test is done, it's called a diagnostic test. For us, we want to do a test even before you have a symptom. So even before you present with a lump or even before you have an ulcer, we want to test you. That is when it's called a screening test. So this screening test is what is important for us to decrease the death from cancer. So cancer is going to occur at some point. We want to decrease the morbidity from the cancer, that is the complications that can happen from the cancer, the rate of death that can happen from cancer. This is mainly by screening, that is early detection. That is there for a few, for now, for a few cancers it is available. Most importantly, breast cancer, because that is the topmost cancer in our country also. Breast cancer, definitely there is a screening test, that is mammogram. A simple X-ray of the breast that has to be done, just has to be done only yearly once. Or if you are at a higher risk with the family history or anything, you can discuss with your oncologist. You might need a different schedule. But for most of the women, yearly one mammogram. And one more important test is self-breast examination, just you yourself examining your breast. That is also very important. So these two screening tests for breast cancer can definitely decrease the rate of cancer deaths, because now since it's the topmost cancer death issue, so that will help us decrease. Then for cervical cancer, there is pap smear testing. Just a small smear, it is not at all a painful procedure, it's an office procedure. Can be done on OPD basis. Just a small pap smear test, along with that, if HPV DNA is combined, can be done only once in 3 years or even once in 5 years if HPV DNA is done, and that will help in preventing a lot of cervical cancers, as I told you, because there's a chance that we might be able to pick up the pre-invasive stage, that is the pre-malignant stage. So at that time, if surgery is done, uterus is removed, cervix is removed, then we need not have to wait till the cancer is developed. And also there is for oral cavity cancers, as of now the only test that can be done is an examination by a doctor, because there is no as such any screening test available. Not effective screening test is still not available. So if someone has been a tobacco chewer in the past, first important is to stop chewing tobacco or smoking. So if you have been a smoker or a tobacco chewer in the past, then you can get a regular yearly once or once in 6 months test by a doctor who will examine you, see for any ulcers or anything. And for lung cancer, there is something called a low dose CT scan that can be done. That is also effective, and these tests are not as effective as a mammogram or a pap smear as of now, but it can be done in those who are at high risk. That is, if you've been a smoker for a long time, if you're more than 50 years of age, definitely it can be done. And for colon cancer, there is colonoscopy that's available. That also has to be done only once in 5 years, or depending on your risk, it will vary. So if there is something called a polyp which occurs before the colon cancer occurs, it arises from the polyp usually. So if that polyp is detected early, it can be excised through colonoscopy itself, does not require a major surgery. So if that is done, then we can avoid cancer from developing. Yes, if you talk about our prevention, there is one is primary prevention. That is where these vaccines, stopping tobacco, chewing and all that comes. primary prevention. Your screening will be a secondary prevention. So primary prevention is stopping the cancer from developing itself. Your screening will be, you can't stop your cancer from developing, it is there, but then you try to detect it as early as possible. So first, that is again important, is one important thing is awareness. So no two cancers are the same. So even if you take breast cancer also, or if you take cervical cancer, or for that matter colon cancer, no two cancers for two different patients are the same. So there are multiple factors that are in this cancer. Like suppose we take out the cancer tissue and send it for testing, there are multiple things that we see in that. So for in breast itself, there can be like ductal carcinoma, lobular carcinoma. Two different things, they behave differently, but collectively it's still called breast cancer. And there is again grade 1, in any cancers, there's grade 1, grade 2, grade 3. Each one behaves differently. There are other factors like immunohistochemistry testing. In breast cancer, it would be ER/PR status, or the estrogen receptor and progesterone receptor status, or the HER2 receptor status. So these three itself, you can see the permutations and combinations. Anything can be positive, anything can be negative. So there are multiple permutations and combinations, and each tumor behaves differently. So even in colon cancer, if you see if it's an MSI positive or an MSI negative, both those tumors behave differently, because the treatment that is available for each type of tumor itself is different. So you cannot compare one person's tumor with another one. One person's stage 1 might behave differently from another person's stage 2, because the tumor biology is different. Tumor biology, for no person it's the same. It is much in-depth understanding. Each tumor cell, what that cell has, what is the DNA changes that has happened. So now we have come into a stage of more of what you call personalized treatment. So treatment initially for cancer was like everybody is going to get this treatment or this chemotherapy. Now if you take one particular cancer itself, anything, even for lung cancer, in lung cancer there is adenocarcinoma, squamous cell carcinoma, for a small cell carcinoma. Treatment for squamous cell carcinoma is different from that of adenocarcinoma. The chemotherapy that is given is going to be different for adenocarcinoma or for squamous cell carcinoma. Anywhere in that body, I'm just telling an example of a lung cancer. Treatment has changed in a long way, because our understanding about cancer and its biology has changed. What is the reason for this cancer to occur? What are the targets that are available in this cancer so that we can target them? Targets, if they are available, it's easier for us to treat them because there are immunotherapies and targeted therapies available for that. So treatment has come a long way. It is not like what it was before. So if you cannot compare one person's treatment, if some person might be getting 6 cycles of chemotherapy, for that same disease we might be giving 8 cycles of chemotherapy for another person, because that tumor biology is different from this tumor biology. So that is one thing that is very important for people to understand, because cancer treatment has definitely changed much more than any other treatment in any other field of medicine. Yes, I have seen many patients. One is important is they feel it's painful, because again, as I told you, they are comparing it with someone, their neighbor or their relative who was detected with probably an advanced stage of cancer at like long back, many years ago. So they always compare it to them. They have seen the pain that they have gone through. They don't want to go through that same pain. But as I told you, if it's detected early, more of like even now, whatever the chemotherapy drugs that are available, there are targeted therapies that are available. They are much more they were less toxic than what is available before. So regimens have changed, chemotherapy regimens have changed, drugs regimens have changed. They have made changes in the drugs so that they can be much more tolerable to the patient. So you cannot compare what that person has taken to what you are going to get. And one more important thing is, many women come to us because they don't want to take chemotherapy because there's going to be hair fall. Because it's a very much concerning issue for people. So that is also, again, I have to tell you, whatever this treatment related side effects you're going to have, like a hair fall, or you might feel little weak. And that also, weakness is different for different people. Someone might feel a lot more weaker than someone. There was a patient last 2 weeks back, I believe, whom we did surgery, and she herself was telling me, I did not have any side effects of chemotherapy. She has tolerated the chemotherapy very well. Chemotherapy was like a piece of cake for her. She's completed 6 cycles of chemotherapy. She was absolutely fine. She's like, doctor, I didn't have a single side effect except for the hair fall. No other side effects. She didn't even have vomiting or nausea. So for each person, it's going to be different. Yes. Yes, and even there are other medications that are available to take care of those side effects also, be it your weakness or your nausea or vomiting. Yes, supportive care and also medicines for that. We give you prophylactic medicines when giving chemotherapy that will take care of the nausea and vomiting. So it is not much of a troublesome now like it was before. Or even for that matter, hair fall that's going to be temporary, because once your chemotherapy is done, your hair is definitely going to be coming. It's going to come back. It's not a permanent thing. So you can use a wig or something at that point of time. These are all temporary solutions that can be managed. Even if you take total count, the most important side effect of chemotherapy is your total counts and your hemoglobin dropping. There are injections available for that, which will prevent the total count from dropping. So all these, there are a lot of advances that have happened that will take care of even the side effects also, and the side effects have become minimal compared to what it was before. And each person's tolerance to that side effect is way different from the other person. So comparison is definitely not the way to go when it comes to cancer treatment. So first of all, whenever you have a symptom or a sign that could probably suggest cancer, first important thing is don't panic. But you have to be cautious. Definitely you have to be cautious, because 90% of the time sometimes it might not even be cancer. But there are still 10% chance that it might be cancer. So the first and important thing you can do is get it tested. Consult a specialist for that, because cancer specialist is different from other specialist. So if you feel you have a cancer, better to consult a cancer specialist. And once you consult a doctor, you might be required to do a few tests. Please do not get frustrated with the test, because cancer, as I told you, cancer surgeries are not as simple as any other surgery. It's not as simple as removing your appendix. Cancer surgeries could make some changes in your body. So there are going to be a few tests that are going to be done. If not few, a lot of tests might be sometimes. First is we need to diagnose your cancer. What type of cancer we need to know that. So that has to be done. Then we need to stage your cancer, because staging is what decides your treatment. So to stage the cancer, we might do a few more tests. So first important, please do not get frustrated with the number of tests that are going to be done. It is a protocol that we follow. Any cancer, any stage, it's a protocol that we follow. It is not something that's done only for you. Cancer tests are a protocol for all patients. Okay. And second thing is, most of the cancers, unless it's detected in a very early stage, do not have a single modality of treatment. In cancer, it's always a multimodal treatment. That is, you might have to undergo surgery with chemotherapy, or surgery, chemotherapy and radiation. And the sequence of this treatment also will be different for different people. It will again depend on your tumor biology. So don't get frustrated again with the number of treatments that you have to go through. It is again a routine for everybody. And you need some patience, because cancer is not going to be cured in one day. Cancer definitely takes time. Cancer treatment takes time. Just a little bit of patience, a positive attitude, a little bit of willpower.